Madam. Bismillahirrahmanirrahim. Today my topic of presentation is health sector financing in Pakistan and Sehat Sahulat scheme. Do good and good will come to you. Learning objectives of today's presentation is health financing introduction, sources of health system funding, healthcare financing of Pakistan, various health financing agents in Pakistan, economic survey of Pakistan, facts, recent, the evolution and health financing, protection, financial protection and its indicators uh, by WHO, recommendation for effective health financing, Sehat Sahulat scheme program of Pakistan, recent advances and MCQs. Learning outcome. By the end of this presentation, participants will be able to describe the health financing, sources of health system funding in Pakistan, healthcare financing system of Pakistan, health financing agents in Pakistan, and Sehat Sahulat program of Pakistan. Health system. Health system consists of all organization, people, and action whose primary intent is to promote, restore, or maintain health. A good health system delivers quality services to all people when and where they need. The exact configuration of services vary from country to country, but in all cases it requires a robust financing mechanism, a well-trained and adequate paid workforce, reliable information. According to WHO, six building blocks, there are six building blocks: service delivery, health workforce, information, medical products, financing, and leadership or governance. And health financing is one of the component of health system building block WHO frameworks. And then intermediate goal: accessibility and coverage, quality and safety, and outcome include improved health through adequate level of health and equity, responsiveness, social and financial risk protection, and improved efficiency through this building block. There is various building block interactions, leadership and governance, health workforce, health information system, medical products and health financing, and service delivery. And criteria for this is the accessibility, coverage, efficiency, equity, quality, and safety and sustainability of services. And its impact is the to increase responsiveness, risk protection, improved health of the community and the patients. Often, people or individuals or household is often considered as seven building block of WHO framework, and it includes communities, civil society, consumers of health care, patients, payers, producers of health through knowledge, attitude, behavior, and practices. Therefore, people which are include individuals, household, and communities often considered as seven building block of WHO framework. Financing. A good health financing system requires raises adequate funds for health, ensure accessibility to quality healthcare services regardless of ability to pay, protects people from financial catastrophe, allocate resources and purchase goods and service in a way that improve quality, equity and efficiency. Therefore, health financing is one of the main functions of health system. It is defined as raising or collection revenue to pay for the operations of health system. It is a key determinant of health system performance in terms of equity, efficiency, and quality. It functions as revenue collection from various sources, pooling of funds and spreading of risk across larger population, allocation or use of funds to purchase services from public and private providers of healthcare, health financing within the system. Raising adequate funds, manage these revenues to pool health risks, and purchase health services is carried out. Now, situating of healthcare financing within the overall health system. Health financing system within overall health system include creating resources, investment, resources, technologies, revenue collection, purchasing, and stewardship,
नायरा चली गई
governance, and service
नायरा चली गई
benefits. These intermediate objectives include universal health coverage, equity in resource distribution, efficiency, transparency, and and accountability. Final goals I already discussed: utilization, protection, and financial quality. Funding system source. The following are the three broad categories of healthcare providers, which include public private provider, non-government organization providers, and non-profit institutions. Mechanisms of methods of healthcare financing is which include general earmarked social insurance system, private insurance premiums, community financing, the out-of-pocket financing. Mechanism of the method of healthcare financing. Taxation is an important source of health financing. It can be used as generally in United Kingdom or earmarked as in France. Earmarked taxes have more advantage over general tax being more reduces the resistance to taxation among the public. Social insurance work as shared approach. Any agency or most likely government pools the risk and respond them. The social health insurance is more transparent and eventually more acceptable to the people. Its advantages private insurance and risk-rated insurance. Disadvantages include reluctance of employees to contribute to the insurance agency. Moreover, being an individual body, it is more prone to political interference. Private insurance premium don't have major contribution in healthcare financing, yet it cannot be ignored. Its focus remains narrow as it covers only a minority of population and that some of health-related conditions. Out-of-pocket spending occurs especially in developing countries like Pakistan. The out-of-pocket payment spending in health is inversely proportional to better healthcare system. Now, some healthcare financing of Pakistan. Outcome the current setup of government include federal, which can make policy, budget, surveillance, and monitoring and valuation, funds, oversight, and reporting. Then come hierarchy level provincial, which include direct site, oversight, monitoring, and valuation. And then at the bottom level, there is district hierarchy, which includes fund, oversight, reporting, and it includes direct implementation, monitoring, and evaluation. Healthcare financing of Pakistan has serious issues in health system, for example, accessibility, availability, affordability, efficiency, and governance. Notably, member countries of Organization of Economic Cooperation and Development (OECD) spends more than 8% of their GDP on health. But the health sector in Pakistan has received increment in budgetary allocation over the last few years. But these are not adjusted for inflation, population growth, and burden of disease, leading to unresolved issue for social protection and health for all. Currently, Pakistan is spending less than 0.53% of its gross domestic product on health and 2.6% including the private sector. The finances for healthcare are contributed by out-of-pocket, government incomes, industries, private insurance, external funds, NGOs, and global funding. Foreign aid constitute only 2% of total funding, and social insurance system is limited to civil servants, armed forces, policies, and formal sector employees, which make up 3% of total population. Now, where it goes to the fund goes government, where the prevention, creative, and infrastructure. The private sector and NGOs mostly it goes to the curative side. 85% of health budget is allocated for curative care, while primary healthcare services which caters 80% of population receive only 15% of the budget. Therefore, the most common modes of health financing are through general taxation and out-of-pocket payments, and 80% of financial resources in public sector are provided by government of Pakistan. And outpatient medicine is the most common cause of out-of-pocket payments that exceeds the household capacity to pay in developing countries like Pakistan. And this is also a case in many countries in WHO European region and is almost the case for poor people in every developing country. For example, if we see economic survey of 2017 to 18 in recent percentage, the total health expenditure by main funding agencies in Pakistan, 51.7% by private health setup out of pocket payment, then 29.7 through federal or provincial government, and then various 3.1% through military health and 5.9 through local NGOs and insurance, and other is less than 2%, which include private health insurance system, social security funds, and military health and official donor agencies. Key health expenditure indicators by SAR countries along with China and around 2017 to 18, and it showed that the current health expenditure as percentage GDP is 3.2% in Pakistan, and in US dollar, it is 48% in 2017 and 18, and out of pocket health expenditure as percentage of current health expenditure is 56%. As we see, out of pocket expenditure of Pakistan from 2000 to 2018, it may be increase and decrease. Sometime it may be 80, then it start gradually decreasing, and now decreasing in 2018, it is almost 50s 40s range. Current health expenditure per capita in US dollar Pakistan has been increased from 20,000 from 2000 to 2019 about 40 US dollar. Therefore, the total health expenditure in Pakistan in the following 2017-80s is estimated as 1206 billion. This shows an increase of rupees 288 billion over the following year 2015 to 16. As show in the column that 2015 to 16 total health expenditure is 918,485, and then it is shows that percentage change is 31.34%, which shows a 31% increase in nominal terms at in include inflation of healthcare goods and services. But it is pertinent to mention that this 31.3% shown is include overall change for time span of 2 years. But the recent economic survey of Pakistan 2020-21 showed that the country's health expenditure totaled 1.2% of gross domestic product in outgoing financial year against 5% advocated by WHO. It was slightly more than 20 to 18. The cumulative health expenditure by federal and provincial government went up 14.35% from 42.78 billion last year to rupees 482 billion this year. As we can see in 1960, the percentage health expenditure on health in percentage of GDP, it is in 2008 or 9 0.5%, and then through various years 2000 is 0.5%, and through various 10 years from 2010 to 20, and recent survey include economic survey 2019 to 20, it become 1.2%. It is increased but slightly increased, but not up to mark as recommended by WHO. Therefore, there is some resource allocation problem in Pakistan, which has essentially play important role in public sector in directing resources to underserved geographic area, underprivileged population growth. Low spending on health is not only impeding factor in provision of equitable, accessible, and efficient services. There is also an issue of imbalance in allocation of resources to developmental and non-developmental annual plans. Over the years, non-developmental health spending has remained high compared to developmental projects budget. Notably, the provinces spend 70 to 80% of the health expenditure on non-developmental and recurrent expenses, including salaries. The health financing system is also affected by devolution in Pakistan, and Pakistan health system has experienced two major political transitions. The local government governance ordinance in 2001 and recent the promulgated 18th constitutional amendment. As a result of two major political transition or devolution of social and health sector under the later reform, provincial bodies are now autonomous for administrative and financial decision. This shift in decision making and health services planning to provincial body open up many prospects for developing effective financial mechanism for the health system. Therefore, the financial protection is basically typically relies on two indicators: catastrophic health expenditures, which is associated with out-of-pocket payments for health, reducing health people ability to spend on other essential items. Impoverished health expenditures is associated with out-of-pocket payments for health, pushing or further pushing people on into poverty. Both indicators are thus concerned with impact of out-of-pocket payments. These include cost sharing and informal payments in kind of cash, but exclude payment by third-party payer. Therefore, these financial protection values is not the absolute amount spent out of pocket that is important, but rather the impact of spending on household living standard. Therefore, out of pocket payment that exceed a given share of household capacity to pay are therefore known as catastrophic financial protection. Catastrophic financial protection, and those that push a household below or further below poverty line are described as impoverishing. And it is not absolute amount, but it's all depend on the financial protection is depending on household living standard or not. Therefore, what makes the financial system complex in Pakistan is actually the population growth rate, relentless burden of disease of communicable as well as communicable, non-communicable disease last 2 decades, scarce sources, troubling with alternate mechanism, upregulated private sector, weak administration, inefficient use of available health budget. There are following recommendations are proposed to create effective health financing mechanism in province after devolution to serve poor segment of population. For example, every province should reprioritize of provincial budget, efficient revenue collection, social protection schemes for health, innovative modes of financing health, and donor contribution for developmental assistance. Sehat Sulat program in Pakistan. These are currently initiated in 2015 under envisages of universal health coverage for all Pakistani people. It was launched indoor health coverage in 2015 for provision of indoor hospitalization services. Sehat Sula program is social health program protection initiative of federal and participating provincial and regional government. The program start providing social insurance for poor families and now its coverage gradually being increased. Other socio-economic strata of population include ICT, Azad Kashmir, Gilgit Baltistan, Khyber Pakhtunkhwa, Tharparkar, and Sindh. Today, federal government and government of Punjab under its Qawmi Sehat Card is providing free of cost insurance to more than 10 million families and additional 25 million population district under its domain. Guiding principle include of this everyone target has right to access safe and quality indoor healthcare service. The government commits to in international agreement like Geneva Declaration, Alma-Ata Declaration, Sustainable Development Goal. Pakistan consists of people with different cultures and way of life, and Charter of Services acknowledges and respects their differences. The benefit package include the priority disease treatment package indoor healthcare only. Initial package include 3 lakh per family per year and additional coverage if required 3 lakh per family per year. Disease covered in package heart disease, diabetes, complication, burns, accident, dialysis, chronic disease, organ failure management, cancer management including chemotherapy, neurosurgical procedures. Secondary care treatment include initial coverage 60,000 family per year, additional coverage 60,000 per year. It will include all medical illness, all surgical illness, maternity services, including normal delivery and C-section. Benefit rider, all emergency covered up to 4 antenatal and 1 postnatal checkup, complementary counseling on family planning, provision of long-term contraception, 1 free follow-up post-admission. These are all inclusion criteria: disease covered, cardiovascular disease, diabetes, burns, end-stage renal disease, chronic disease, organ failure, oncology, neurosurgical. But exclusion criteria include cause resulting from self-inflicted injury or attempted suicide, abuse or alcohol, psychotic or mental nervous disorder including neurosis, treatment of investigation, fatality, infertility, sterilization, contraception, participation in any training or any dangerous hazardous sport, pastime or competition, injuries as a result of illegal act or other minor misdemeanor or minor delinquency by the insured person, injury or treatment resulting from war, riots, or invasions, ionizing radiation, contamination by radioactivity, services or treatment, AIDS or AIDS-related complex, and all disease covered by any or related to HIV virus or any other sexually transmitted disease, environmental or unproven treatment, all dental treatments, cost of correction of refractive errors, cosmetic or plastic surgery unless it is reconstructed surgery, any increase in expenses and outpatient treatment, any charges in respect of donor for organ transplant claims, prosthetic or corrective devices, personal comfort items, treatment received in allocation other than the insured person geographic area of coverage. Conclusion. Healthcare financing is an important component of health building block. It encompasses 3 important functions of revenue collection, risk pooling, purchase of health services. Countries go about 3 basic functions in diverse way. It is, however, important to raise enough revenue to have good health financing system that delivers quality services to all people. Now some recent advances. An article is published in 2021, which include public health expenditure and health outcomes in Pakistan, evidence from quantile auto-regressive distributed lag model. The aim is to explore the facts of healthcare expenditure and actual health status of masses in Pakistan from period 1995 to 2017. They use quantile autoregressive distribution lag approach for estimation purpose. Findings show that public healthcare spending significantly impact health outcomes in Pakistan both in short term and long run. Public healthcare spending improves life expectancy and reduces death rate and infant mortality rate. Another paper is done published Healthcare and Budget 2020 to 2022. It indicates that Pakistan is now low spender on health. To put things into perspective, according to estimate done in 2017, Pakistan spent 845 per person on health, while Iran spent 884 and Qatar spent 17 $16 per capita. What is noted that $86 is recommended as minimum public sector spending, whereas above mentioned 45 per capita dollar in Pakistan is total health expenditure. The breakdown is distributed that $14 is spent by public sector on each citizen, whereas citizens themselves spend $28 through private sector spending, and mere $3 comes from external sources. Therefore, not only do we need more money for health, but also need more health for money spent. Therefore, building a universal health coverage investment case recently, the World Bank estimated in order to implement the universal health agenda in 44 districts of Pakistan over a period of 5 years, an additional extra expense of $17 per capita would be required. This means doubling the public sector spending is $31.4, regardless of how inflated or conservative these estimates are. Another article published explored willingness to pay for health insurance and preference for benefit package from perspective of women from low-income household of Karachi in Pakistan. This is actually the aim is to evidence from designing a feasible health insurance scheme targeted at poor, exploring preference for health insurance packages and co-payment among women from low-income household in Karachi. This is descriptive cross-sectional study conducted using household survey between July to August 2015. A total of 167 female beneficiaries of Basic Income Support Program on a large-scale cash transfer scheme was targeted at low-income household. These results include respondent reported expenditure on OPD and hospitalization in last 2 weeks for 93%, 11% respectively. The highest median expenditure was occurred on medicine. Out of proposed benefit package, a majority of 53% study participants opted for comprehensive benefit package that provided coverage of emergency care, hospitalization, and OPD consultation, diagnostic test, and transportation. The study concluded that health insurance scheme can be introduced in urban areas against allocation of micropayments to prevent low-income households from facing financial catastrophe. Financing mechanism applied for successful universal health coverage in Malaysia, Thailand, and Singapore, lesson for Pakistan. Another paper published. This showed that universal health coverage is global agenda, and currently for Pakistan achieving this goal is a challenge. This current narrative review has planned to describe an overview of Malaysia, Thailand, and Singapore healthcare system in achieving universal health coverage. The literature was conducted from Google Scholar and PubMed, and the three studied countries achieved universal health coverage by gradually increasing allocation for health and through various mechanisms such as health insurance scheme, which cover different segments of population, partnership, public-private care provider. Pakistan need to prioritize health in health policy agenda because health insurance is negligible in Pakistan. Pakistan also need to efficiently utilize partnership with the private sector to further increase healthcare coverage. There is also WHO framework in designing health financing system to reduce catastrophic health expenditure. It includes every year more than 150 billion individuals in 44 households face financial catastrophe. What is a catastrophic health expenditure? It includes when people have to pay fee or co-payment for healthcare. The amount can be so high in relation to income that it results in financial catastrophe for individual or household. Moreover, the impact of out-of-pocket payment for healthcare goes beyond catastrophic expenditure. WHO therefore proposed that the health expenditure be viewed as a catastrophic whenever it is greater than or equal to 40% of household non-subsistence income available after basic needs. When it is more than 40%, then it is recommended as catastrophic health expenditure. As to graph, it is showed that where out-of-pocket spending is less than 15% of total health spending, few households face catastrophic payments. How catastrophic payments can be reduced? through extend population coverage through payment, prepayment mechanism, protect the poor and disadvantaged, design a definite benefit package, decide the level of cost sharing by the patient. But in the long term, in order to reduce the catastrophic expenditure, the aim should be to develop prepayment mechanism through social health insurance, tax-based financing of healthcare, and some mix of prepayment mechanism, which can in long term reduce the catastrophic expenditure. Now MCQs. MCQs 1. The World Health Organization has developed a framework for health system strengthening that depicts health system in terms of 6 building blocks. The dash is often considered as 7 building blocks of health system. A. Health information system. B. Health workforce. C. Leadership. D. Patient. E. Quality, personal and non-personal health interventions. What will be the correct option? Delta. As I already mentioned that person or people is often considered as 7 building block of health system. Therefore, delta patient is often considered as health building blocks of health system as they are the consumers of health services. MCQs 2. In 2019, XYZ Country Declaration on Non-Communicable Disease country leader committed to increase health spending from 10 to 15% of their government budget in order to establish the financial foundation necessary to combat non-communicable disease in their XYZ country. It demonstrates which aspect of health system: A. Leadership, B. Health information system, C. Health financing, D. Health workforce, E. Medical products and
C.
a C health financing system, because as one see that there is increase of budget allocation for non-communicable disease, therefore C will be the correct option, health financing. MCQ 3. In 2017 to 2019, a healthcare organization in ABC country has an inefficient healthcare financing system that it aims to fix by the end of 2020. Which of the following will greatly assist ABC country healthcare organization in increasing its efficiency? A. Expansion of social health insurance scheme. B. Increasing rate of medicine. C. Increasing rate of healthcare provider service charges. D. Investment in real estate. E. Increase of out-of-pocket payments. What will be the greatly assist?
A.
Alpha.
A.
Alpha will be the correct option, as an expansion of social health insurance scheme will greatly assist the developing country in improving the efficiency of healthcare organization. Therefore, alpha will be the correct option. MCQs 4. Financial protection is measured by looking at out-of-pocket payment in relation to which of the following: alpha, government spending on health, household living standard, private spending on health, social economic status, total spending on health.
B.
Beta will be correct option, as financial catastrophe protection is not in actually in terms of actual mode, but largely it is depend on household living standard. Therefore, it is measured by looking on the household living standard of the individuals. MCQs 5. Health funding is critical component of health system because it enables progress towards universal health coverage by enhancing service coverage and financial protection. What type of efforts should be performed to ensure effectiveness of healthcare system? Alpha, enhance the quality of healthcare by increasing fees charged by healthcare provider. Enhance the quality of healthcare by increasing the rates of medicine. C, increase direct out-of-pocket payments from users. D, investment in real estate, or E, revenue rising from various sources.
B.
E.
E.
E will be
E.
correct option, that we should raise various revenue collection from various sources, NGOs, through social schemes and various private sectors and other philanthropists in order to ensure the effectiveness of healthcare system in developing countries. MCQ 6. Which of the following is most prevalent cause for out-of-pocket payments that exceed a household ability to pay for poor people of XYZ community? Alpha dental care, B inpatient care, C outpatient medicine, D surgical care treatment in private facilities.
C.
E.
E will be correct
E.
option, outpatient medicine. As according to recent WHO survey, and I already mentioned it as a survey conducted in Pakistan, that the most prevalent cause of out-of-pocket payment in any developing country or also in WHO European region, according to survey, is the outpatient medicine, which exceed a household ability to pay for poor people, and also this is a case in the poor people. Therefore, outpatient medicine is most prevalent cause of outpatient pocket payment in developing country. C will be correct option. MCQ 7. An out-of-pocket healthcare expense that exceed a household income or capacity to pay is called catastrophic health expenditure. Catastrophic level of household spending on health always involve alpha decreasing a rate of inpatient service charges, beta decreasing a rate of medicines, C decreasing the fee charged by healthcare provider, D large out-of-pocket payment, E reduction out-of-pocket payments.
D.
Delta will be the correct option. Catastrophic health expenditure, according to WHO, include always involves a large out-of-pocket payment. Therefore, delta will be the correct option in case of catastrophic health expenditures. MCQs 8. Health expenditures account for 2% of global GDP in the ABC country. Health spending of ABC country includes government, out-of-pocket payments, and non-profit activities. Why do people have to pay out of pocket for healthcare? Alpha health coverage include things like outpatient medicine or dental care. Beta, they don't have adequate health coverage. C, treatment involves formal payments. Treatment involves co-payments. Or E, treatment involves informal payments. What will be the correct
B.
option? Beta, yes, correct. In this option is beta because as we see that the health spending of ABC country, though although the sources of health financing exist, for example, government out-of-pocket payment, but people can also purchase other services because they don't have adequate health coverage. For example, they don't have adequate social insurance system, and therefore, and as you see in this scenario, there is also the total allocation of budget from GDP is also low, which is 2%. Therefore, in this scenario, beta will be the correct option that they don't have adequate health coverage like developing country in Pakistan. MCQs 9. An ABC developing country health expenditure has been catastrophic over last decade. National health financing system has been implemented in several regions in recent years in ABC developing country. In long term, the ABC country can achieve its goal of reducing catastrophic health expenditure by implementing one of the following mechanisms. A. Extend population coverage to prepayment mechanism. B. Increase health coverage include things like outpatient medicine. C. Protect the poor and disadvantaged. Delta. Provide treatment involves increased formal payments. E. Provide treatment involves increased informal payments. What will be the correct option? Alpha will be the correct option as I already mentioned in WHO health financing catastrophic framework that in long term in order to achieve the goal of reducing catastrophic health expenditure, no doubt all recommendations are should be fulfilled, but in long term the any developing country should extend our population coverage through prepayment mechanism through various introduction or of Sehat Sulat card or other social protection schemes in developing countries through poor or marginalized community. Therefore, in long-term prepayment mechanism always reduce the catastrophic health expenditure and implementing one of these mechanisms. Therefore, alpha will be the correct option as already mentioned in WHO framework documents. MCQs 10. When individual or household are required to pay healthcare fee or co-payment, the amount can be so high in comparison to income that it results in financial catastrophe for the individual or household. WHO has proposed the health expenditure be viewed as a catastrophic whenever it is greater than or equal to alpha 10%, beta 20%, C 30%, delta 40%, or E 50%.
C.
Delta will be the correct option as WHO, as we
B.
already know that 40%. Financial catastrophe, as I already mentioned, that is always known as when individual or household required to pay healthcare source of co-payment when its amount can be so high in comparison its ability to pay or income, then it results in financial catastrophe. Therefore, WHO has proposed a cutoff that if the health expenditure of any household or individual be above 40% of their total health expenditure, then it is greater than equal, then it is said to be in a state of financial catastrophe. Therefore it is recommended 40% of their total health expenditure. So delta will be the correct option. Key of MCQs. And thank you.
Thank you very much. Excellent presentation, Dr. Khansa. And especially the points that you have made during your presentation about the financial system and why it is so complex in Pakistan, especially the points that you have highlighted during your presentation, they should be well taken. The most important thing is about the population growth, and we all know the finances, they can't be enough till we control our population. And the exploring the willingness to pay for the health, especially for the health insurance, and the preferences that are associated with it from the low income households, that is one of a very good study that you have presented. The scarce resources is one of the reason that why people are not able to get the full health services, and how their quality of life is being compromised. The trouble with alternative mechanisms, as you have said, one of the greatest thing is about quackery. And again, the healthcare systems, they need to control and snub this quack practices, and to make the alternative mechanisms that are cheap, cost effective, and are easily available, along with the trust of the people, so that they can utilize it. The burden of the disease, yes, it has been increased over the years, and it is now relentless. And we know that the burden of the disease can only be controlled with prevention. So the most important point, whatever cost effective system is being generated, the most important point is still prevention. Again, you have said about the unregulated private sector. One of the main purpose of having the healthcare commissions is for the better regulation of the private sector.